everyone, this is Bushra. Welcome to my channel Marvellous Concepts. As we have discussed in previous video about the basic pharmacology definition and types, now let's talk about pharmacodynamics and pharmacokinetics. Pharmacodynamic is a very important concept in pharmacology, and it's one of the main points to understand pharmacology and to understand mechanism of action. Initially, let's know about its definition. That is, what does drug do to the body? When we are talking about the effects that are caused after consuming a drug, then actually we are talking about pharmacodynamics. Understanding pharmacodynamics is very easy. For this, you have to ask yourself these two questions. First one is, why are you taking medicines? The second one is, what happened when you took medicine? If you have answers for this question, then it will be very easy for you to understand pharmacodynamics. As long as I know, you must have known answer for this question. For this question, why are you taking medicine? Obviously, you're having any disease or disorder. To cure this, we will take medicine. That's nice. The second one is, what happened when you took medicine? You have taken medicine, okay. Then what happened after you consumed? After taking medicine, the problem due to which you took medicine get cured, prevented, or controlled or maintained. It's very good. Has it ever happened to you? After taking a medicine, you might have experienced certain unwanted effects such as headache, vomiting, dizziness, nausea, or any other kind of discomfort that you didn't want it to happen, but it happened. In pharmacodynamics, we study the effects of drugs shown. It will either show desirable effects or it will also show undesirable effects. What's desirable effect? It is a consequence of treatment of any kind, the results of which are just to be useful or favorable. Treatment of any kind. It might be for diagnosis, prevention, treatment, or for improvement. If you have taken vaccine and it has shown good prevention, or to treat certain disease you have taken a drug and it have cured certain disease. And sometimes you will take drugs for a supplementary diet to maintain normal health, and it has shown improvement in our health. These all comes under desirable effects. When come to undesirable effects, it shows side effects, adverse effects, toxic effects. Side effects are normally mild and we already know about it before taking certain medicine. For example, cough syrup such as dextromethorphan. It will suppress cough along with it will cause sleepiness. Some may cause serious effects such as rashes that comes under these adverse effects. And some may also cause toxic effects and may also lead to organ failure. These are all the drug effects. Desirable effects are those we wanted to happen, and undesirable effects are the ones that we don't wish to happen but happened. Both the effects are called pharmacological effect or pharmacodynamic effect. For example, let's talk about antibiotics. What are its desirable effects and undesirable effects? When we talk about desirable effects, antibiotics are the agents that destroy or slow down the growth of bacteria. Bacteria normal cell growth requires cell wall, cell membrane, DNA, RNA, protein, and enzymatic reactions. Here what happens is parent DNA of bacteria undergoes replication and form multiple DNA. And these parent DNA or either undergoes transcription or translation to form mRNA and further developed into protein. Bacteria multiply using this protein, and with enzymatic actions it performs its activity. These are important for bacterial growth. To prevent the growth, we are taking antibiotics as drugs. It ruptures cell wall due to which bacteria gets destroyed. Another, it will increase cell membrane permeability and penetratability due to which contents gets leaked out and bacteria gets completely destroyed. Or it disturbs DNA synthesis which prevent formation of daughter DNA and its development gets halted. Or it will inhibit protein synthesis. If protein is not there, structure cannot be developed. and without protein, survival of bacteria is not possible. It will show action by inhibiting the enzyme binding and destroy the bacteria. These are all the actions that our antibiotics show, which might be desirable or undesirable. These are called pharmacodynamic effects. Pharmacokinetics. Pharmacokinetics also have similar concept, but there's a change. Definition is what does body do to the drug? To understand this, you should ask yourself this question. What if drug remains as such in body? If we took solid dosage form, and what if it remains as such in stomach? Well, there will be no outcome and our purpose for taking drug will not get fulfilled. Hence, the response of our body to given drug is very important, which we call pharmacokinetics. What our body do after taking drug is ADME, which means absorption, distribution, metabolism, and elimination. Absorption describes how the drug moves from site of administration to site of action, whereas distribution describes the journey of the drug through the bloodstream to various tissues of the body. To maintain homogenization, drug is distributed to different compartments of the body. When it comes to metabolism, it is also called as biotransformation. It describes the process that breaks down the drug. In this, the drug converted from inactive form to active form and from active form to inactive form, from toxic to less toxic. To determine it in easy way, it is the process of conversion of complex molecule to simple molecule. Here, elimination describes the removal of drug from the body. If the body doesn't eliminate the drug, the concentration of drug increases and accumulates in the body, which leads to toxicity, which is very harmful. Drug accumulation is always dangerous for a body. Elimination of a drug from body depends upon nature of drug. Water-soluble drugs get eliminated through urine, while lipid-soluble drugs get eliminated by stools. If its nature is volatile, it will get eliminated through exhale. If it's highly lipid-soluble drug, it will be eliminated through saliva, and in lactating women, it will be eliminated through milk. Once we took a drug in oral dosage form, that is tablet, given through oral route, this tablet reaches GIT, where tablet break down into small particles, which is called as disintegration. In next step, the drug particles get dissolved with present body fluids, which is called as dissolution. Disintegration and dissolution are very important parameters to check efficacy of any drug. These may also affect bioavailability. In further step, the drug moves forward through small intestine and cross different barriers by following different transport mechanism. It reaches into her bloodstream. Here, our first phase of absorption gets completed. Blood will distribute the drug to different compartments or body parts, that is called as distribution. It happens so that equilibrium concentration can be maintained. In further step, from blood, drug reaches to liver, where it gets metabolized. Here, some drugs like levodopa, carbidopa gets converted from inactive form to active form. Some drugs which are in already active form may also get converted into inactive form. It will also happen the conversion of toxic materials to less toxic. And after this, the drug gets eliminated from the body through different routes. The water-soluble drug reaches the kidney, whose functional unit is nephron, where filtration takes place. Only hydrophilic substance get eliminated through urine, while the hydrophobic or lipid-soluble substances get mixed with bile produced by liver and excreted out through stools. This is pharmacokinetic profile of drug. I hope you all have understood this. Please feel free to comment down the doubts you have. I'll try my best to help you out. This is it for today, guys. Thank you so much for watching this video. Please make sure to like, share, subscribe my channel. See you later. Bye bye.